Hi, I'm Dr. Carl Engelbardt, and I'm going to speak to you a little bit about cosmetic ear surgery or otoplasty. There are many different types of ear deformities that people can be born with, but the most common problem that I see is the prominent ear, where the ear sticks out too far from the side of the head. And this is due primarily due to a lack of development of the normal ear fold or inadequate development of the ear fold. And oftentimes there's also a very high back wall to the ear, which contributes to this problem. Patients or parents bring young children in to see me because they would like to have the problem fixed before kids start school, when they might be subject to ridicule by their peers. The minimum age for performing rhinoplasty is about 5 years of age, and we have to wait until that time because we want the ear to reach its normal full size before we operate on it. Usually, general anesthesia is required for younger children and children on up into the teenage years. Beyond teen years and up into adulthood, most people can have this surgery done under local anesthesia in the office operating room with some oral sedation. The incisions for an otoplasty are primarily on the back surface of the ear, although there's oftentimes a small incision on the front of the ear that we use to lower the cartilage wall. Uh, after the surgery is done, the wounds are sutured, usually with absorbable sutures, so that there are no sutures to remove. And then we apply a fairly bulky dressing to the ears to keep everything in place during the healing stages. There's usually very little pain associated with an otoplasty, and this is easily controlled with oral pain medication. I see people back at about a week after surgery, and during that time, I like to have them keep their head elevated to keep pressure down in the head, and I also like them not to sleep on one ear or the other. There's the complications are usually very rare with this operation, and if there is a problem with the outcome, it'll be that the ears may not be as perfect as we would like them to be. And perfection is hard to achieve in otoplasty because everybody has two different ears to begin with. Very few people have both of their ears perfectly symmetrical. So we try to make everything as symmetrical as possible, and usually the results are very good. Occasionally, a revision may be necessary, although this is usually quite rare. And if revisions are necessary, we do this in the office under local anesthesia, and it's usually not very much of a problem. People are generally very happy with the results of otoplasty. So if this is something that bothers you and something that you've been living with for a while and have been thinking about having done, we've had a very good experience with otoplasty over the years, and I'd be very happy to meet with you. Thank you.